We will have handouts available on our website at nacra.com after this presentation. Dr. Barrett and Marty Schreiber have agreed to allow us to utilize their slides. So all the information and the recording will be available on the website. So I'd like to welcome you this week during Dementia Week, and we are pleased to present, as I mentioned, ex-governor of Wisconsin, Marty Schreiber, on learning, coping, and surviving as an Alzheimer's caregiver, along with Dr. Matthew Barrett, who will speak on the medical aspects of Alzheimer's. In the upcoming fall, we will be talking and having a webinar on the forever plastics and their effects on both the environment and humans. The information you will receive today, we believe, will be so helpful in understanding the dilemma that caregivers experience while undertaking a care for a spouse with Alzheimer's and the challenges this decision brings about, as well as the detrimental effect it has on the caregiver. We are honored to have ex-Governor Marty Schreiber to discuss coping and surviving an Alzheimer's caregiver, and Dr. Barrett, a neurologist from Virginia, will explain all the medical aspects of Alzheimer's and the unintended consequences suffered by the caregiver. But first, I'd like to turn this entire program over to our director, Dr. Chuck Webb, who has brought this program together and is responsible for bringing it to you. Chuck?
Thank you, Luana. Good day, everyone, and welcome to the NACRA webinar, Caregiving for Patients with Dementia. I'm your host, Chuck Webb, a board member with NACRA. Paul Wynn suggested the topic. He's an author who has written extensively on caregiving. This is Alzheimer's Awareness Week. It's 1 in 4 Americans is a caregiver, and the number of caregivers has risen 45% in the past 10 years. Caregiving for patients with dementia presents challenges, and I think this topic should be very useful. Dr. Matthew Barrett is our first presenter. He's professor of neurology at Virginia Commonwealth University in Richmond, where he teaches, sees patients, and conducts research. He presented last year on the topic of Lewy body dementia. He earned his MD from the University of Richmond and completed a neurology residency there, then completed 3-year fellowship in movement disorders at Beth Israel, and along the way earned a master's in clinical research methods from Albert Einstein. Since joining the faculty at Richmond, he's worked extensively with patients with dementia. He's published articles on over 60 subjects related to cognitive loss and movement disorders. Join me in welcoming Dr. Matt Barrett.
Thanks, Chuck. Appreciate the invitation and the opportunity to speak to you all. So I'm going to talk just about Alzheimer's disease and caregiving as it relates to it from a neurologist perspective, and then look forward to hearing from some personal experience related to that. So the Alzheimer's Association published that in 2023, 11.5 million family members and other caregivers cared for those with Alzheimer's disease and related dementias, and they provided over 18 billion hours of unpaid assistance So while they mention it's unpaid, it's not without love. It's just that it is a large burden on individuals that care for those that have Alzheimer's, and it can lead to some significant impacts on those individuals that might have impacts on their overall health. So social isolation is a pretty clear one. It's hard sometimes to leave the house with someone that has Alzheimer's disease. There can also be reduced overall physical activity, pursuit of hobbies and other interests. And I think a very meaningful one we'll talk a little bit more about is disrupted sleep. In caring for someone with Alzheimer's, it's often a 24-hour role, and that can lead to some people not getting the rest they need to then perform at their best throughout that entire 24 hours. There are also costs that are shouldered by the family, and this can lead to financial stresses and finding care for these individuals that, again, is around the clock, especially if someone is potentially still working. And there's also high levels of emotional stress that result from the strain in the relationship someone once had with the individual that now has Alzheimer's. So some basics. What is dementia? What is dementia the way I think about it? It's or any other neurologist, it's a decline in memory and thinking that ultimately leads to inability to perform daily activities at the level they previously were performed. And this ultimately results in a loss of independence. So individuals that have some cognitive decline but are able to compensate and continue to do their daily activities are said to have mild cognitive impairment. It's when it reaches that level where they then need assistance doing some of those activities that it's at the level of dementia. And the most common cause is Alzheimer's disease. And there's some other frequent causes, vascular dementia, Lewy body dementia, and frontotemporal dementia. And as time has gone on, we realize more and more that frequently these are not the only issue that someone may be dealing with. They may be having both Alzheimer's changes in their brain as well as vascular changes, and that can lead to dementia. And then there's some other non-neurodegenerative causes that I think are important for us to recognize and rule out early in the disease course. Alzheimer's disease, as I already stated, is the most common cause of dementia. It's a slowly progressive neurodegenerative disease, and it is associated with impairment in cognition in general, but particularly in the areas of memory, judgment, and language. Those seem to be the areas more frequently identified as being affected. I'm going to talk to you about the typical presentation as well as atypical presentations. What I mean by a neurodegenerative disease is a condition that results in loss of neurons, usually in particular parts of the brain, and that's what results in the presentation that we see. In Alzheimer's disease, the loss of neurons is associated with the accumulation of two proteins. One is amyloid, which accumulates in plaques outside of neurons and can be seen under a microscope and also measured in other tissues in the body, and I'll speak about that. And then there's also the accumulation of a protein called tau within neurons, and it's these two different abnormally folded proteins and their accumulation that is associated with Alzheimer's disease. Slightly controversial what the role is in causing Alzheimer's disease, but we certainly find them in the brains of individuals that have Alzheimer's. The typical presentation of Alzheimer's involves short-term memory loss. And I want to be careful to identify what I really mean by that. So in Alzheimer's disease, individuals have an area of their brain affected that allows them to form new memories. And so someone that has Alzheimer's disease cannot form new memories. And because of that, they're not able to ever retrieve that information. The opposite of that is a memory lapse where someone may have that information stored, but they can't recall it in that moment. If you give them some cues and enough time, they can retrieve it. That's different from the type of memory impairment we see with Alzheimer's. And the type of memory impairment we see in Alzheimer's can lead to repetition of stories and sometimes repeating of questions 5 minutes after that information was given because that patient never, or that individual never actually formed that new memory in the first place. It could lead to misplacing of items, missed appointments, if they're still managing that. It's caused by degeneration of a particular part of the brain called the hippocampus, which is at the end of that blue arrow. On the left, you kind of see a fuller, normal volume of a hippocampus, and on the left, you see shrinkage of that area. It's on both sides of the brain, and that area is affected very early in the typical presentation of Alzheimer's, and sometimes we can see that on a brain MRI. Can't make the diagnosis based on that, but we might still see evidence of it. And that ultimately, that memory loss can eventually affect someone's ability to do activities of daily living. Some of the variant presentations are language predominant, where individuals have something called primary progressive aphasia, and they lose the ability to remember certain words. And so the fluency of their speech is affected, and ultimately their ability to communicate. Language is so critical to all of our cognition that they often appear to have every area of cognition affected when the language is affected early. This obviously has a particular impact on their relationships and interactions with loved ones. There's a presentation where visual spatial function is affected predominantly. This is called posterior cortical atrophy. Individuals with this might have issues with depth perception, and this can show up in multiple ways. You can imagine it would affect driving, their ability to perform any manual activities. And you could potentially see visual hallucinations with that. And then there's an executive behavioral presentation that looks a lot like a different dementia, frontotemporal dementia. Individuals with this would have relatively preserved memory and language, but they'd have changes in personality, disinhibition, loss of empathy, maybe socially inappropriate behaviors, which would look quite different. But all of these would have the changes of Alzheimer's disease in the brain, specifically those amyloid plaques and those tau tangles I mentioned earlier. And that gets us to how we can now establish a diagnosis of Alzheimer's. This is not the purpose of the talk, but just to quickly mention it, there are diagnostic tests that can help us, even when someone has these variant presentations, to identify whether they have Alzheimer's changes in their brain or not. This is relevant to some of the treatments we have. I'm showing a picture here of an amyloid PET scan, which can use a tracer to bind to amyloid plaques in the brain. On the left is normal. On the right is all that uptake, that dark color, because they do have the amyloid that takes up that tracer. You can measure some proteins in the spinal fluid, and there's now a blood test that's readily used for diagnosis of Alzheimer's, which has greatly changed our field in the last couple years. So now I'll kind of pivot to talk about the impact of some of these changes as they might affect the individual and especially on caregiving. So short-term memory loss, as I've already stated, is prominent in Alzheimer's disease, especially the typical form. And this causes repetition of stories and questions, as I already stated. And it really is a challenge to sometimes learn how to respond to this in an individual experiencing it. Sometimes reminders around the home with whiteboards and calendars can be helpful. Using an established routine might be helpful, just so that there isn't the necessity to ask some of those repeated questions. Sometimes deflecting and moving, to another topic when someone is really fixated on an upcoming event and they're asking repeated questions about it that they can't remember the answer to. Sometimes it's helpful to then move them into redirect them into something else. There's a lack of awareness in Alzheimer's that I think is worth mentioning that something that I think all caregivers and family members have to eventually come to terms with. And that is that their family member that's having Alzheimer's is not aware of the issues they're having. And, rather than, I think, confronting them about the deficiencies they're having, sometimes it's better to realize that they're not going to that this is not something they can recognize in the same way that you can as an outsider. And it can lead to, that conflict and disagreement about what's happening can lead to arguments and conflict and resistance to help. Safety measures like not driving can be difficult to implement when someone doesn't recognize the issues that they have. And of course, it could lead to frustration. So another thing that happens early in the disease is someone has difficulty doing what we call instrumental activities of daily living. I've listed them all here. That includes managing medications, paying bills and finances, managing the finances rather, and driving and transportation. Those are the big ones I ask about. The other ones are included, and we may get some information about. And so there are ways that individuals have to figure out over time, very gradually, take over some of those tasks. Sometimes it happens suddenly when there's a financial issue or some fraud that someone may have been caught up in, and they need to turn over their finances suddenly. Sometimes it's a very gradual process where someone who's done their finances for years starts giving up one bill, they're not doing the taxes this year, and then over time that gets taken over by a caregiver. I think that's always a process, based on the relationship that already exists. There can also be a problems with behavioral symptoms, and so I've kind of grouped these. Um, the uh, common symptoms that you might see related to paranoia and delusions, which can happen to some individuals. They think people are stealing from them. They may believe family members are imposters. That's usually a later symptom if it occurs. General suspicion, and sometimes, usually rarely, fortunately, seeing or hearing things that are not present. That may not always be distressing, but it certainly can be. This obviously these behaviors lead to a lot of difficulty in the relationship between the individual that has Alzheimer's and their caregiver. Supervision needs may be increased. I think it's very difficult when the target of the delusion is the caregiver themselves, either that they're an imposter, that they're trying to harm them in some way. This can really create a lot of strife. And anxiety and depression and apathy, I think the reason to talk about these, especially around anxiety and depression, is that we know that these types of mood disorders can worsen an individual's cognition. And being anxious, well, let me say it this way. I mean, I think sometimes that memory, that inability to form new memories, to really have a full grasp of what's going on in the moment, can make someone extremely anxious. And that anxiety then in turn worsens their cognition and ability to reason. So sometimes treating anxiety as a primary issue may improve cognition and obviously will improve the person's level of distress. Depression is both of these are more common in people with Alzheimer's disease, and that can be treated separately as well. And obviously that can have a huge impact on quality of life. Apathy is here I'm separating from the lack of interest that people may have with depression. Apathy does not coincide with depression necessarily. It's a loss of interest and motivation. And this can sometimes be a real challenging symptom because there's not really great treatments for it, number one. And number two, I think family members, especially when someone before was maybe very motivated, very social, and they're seeing, that opposite type of behavior, this can be really frustrating until people, again, kind of come to terms with the changes that are happening in their loved one. I think along with the delusions and paranoia I mentioned earlier, irritability and agitation can be problematic symptoms that may accompany Alzheimer's disease. This would include increased frustration and anger, verbal outbursts, socially inappropriate comments, and it can be triggered sometimes by nothing at all, seemingly, but certainly could be triggered by overstimulation in the environment, pain, fatigue, sleeplessness, which would affect their ability to respond, appropriately in a situation where they might be under some stress. Just the loss of independence and, can lead to frustration, requiring help in things that they didn't previously need help for. And there are, I think, a lot of ways to try to mitigate that irritability and aggression. Or agitation rather. This is, I think, one of the areas, especially, and maybe all of them, you could say the same thing, where there is no one size fits all solution. Everybody has a different personality they bring with them prior to Alzheimer's disease, and I think that affects how you might communicate with them or try to manage some of these behaviors that can be difficult. I'll just mention briefly sleep disturbances. It's common to hear the story where someone wakes up at 3 a.m., gets dressed, and thinks they're ready to start the day. And, with Alzheimer's disease, because they've gotten some confusion about day and night, that's obviously can be a very stressful behavior to manage, and wakes up the caregiver that they have lack of sleep. So it's just something to recognize. I think, periods of respite, getting some help at night can always help those types of things if they're happening. And then lastly, supporting basic activities of daily living. I think, after the progression of the disease, someone may lose the inability, usually starting with dressing, but then other hygiene, toileting. These can be really challenging for caregivers to manage, especially if someone is having some of those other behavioral symptoms I mentioned before. Lots of ideas that occupational therapists might have, or other people that have had family members with Alzheimer's. So things that can be managed, but certainly that offer challenges. So before turning it over, just in summary, Alzheimer's disease creates a substantial emotional, physical, financial, and social burden for caregivers. And I think it's important for us to recognize that. And I try to do my best of not only addressing my questions to the patient and their situation, but also ask caregivers how they're doing, because I think they can also they're part of this and do in some ways suffer from the disease in different ways. Cognitive symptoms such as did I just go mute? Sorry.
Yes.
Okay. I'll just finish up quickly. Behavioral and psychiatric symptoms, are often some of the more stressful aspects of caregiving. And I think I stated this already, but every individual with Alzheimer's disease is different. And so the approach often has to be different for dealing with these types of things I've been discussing. And now I'm happy to turn it over to Mr. Schreiber.
Let me introduce our second speaker, former Wisconsin Governor Marty Schreiber. Marty graduated from the University of Wisconsin with a degree in urban studies and from Marquette University Law School. His father was a politician, and Marty grew up knowing he wanted to serve in politics. He was a state senator from 1963 to 71, lieutenant governor from 1971 to 79, and governor from 79 to 81. Marty was married to his wife Elaine for 60 years. He wrote the book My Two Elaines. During the last 20 years, she had Alzheimer's disease. The two Elaines were before and after the diagnosis. The book is used extensively in programs that teach caregiving. He self-published the first 3 editions, and then Harper Row picked up the 4th edition. Marty met Elaine in high school. They were both in Latin class together. They married in 1961. First, Elaine was a school teacher and mother of 4. The second, Elaine kept a journal of her experience. Marty has presented this topic over 800 times. He has a great deal of valuable information to share. Join me in welcoming
Marty.
Former Governor Marty Schreiber.
Hi, Chuck, and thank you. First of all, to all of you for what you are doing, thank you so much. It is so important to help people better understand this whole aspect of Alzheimer's as well as caregiving. And also to Dr. Barrett, an excellent presentation. As I listened to you, I had reviewing in my experience all of those some 20 years of the time I was working and helping Elaine on her Alzheimer's journey. So what you are doing is so very, very special. And the reason it is so very special is because, well, I contend if there's one thing worse than Alzheimer's, it's ignorance of the disease. And ignorance of the disease, sometimes by the medical profession, who doesn't understand that when there is a diagnosis of Alzheimer's, there are 2 patients. There is the person who is living with Alzheimer's, and there is the caregiver. And the reason I say that is a Stanford University study pointed out that if you are a caregiver, you have a 40% chance of dying before your loved one due to stress-related illness. Understand that 40%, the mortality rate for caregivers versus non-caregivers is 63% higher. So caregivers, please understand what we are dealing with is a very challenging kind of situation that could mean your death. And that does not mean anything good for anybody. And so what happens is if we get this diagnosis, first of all, we go back, almost now, Elaine has passed away for 3 years, so it was almost now 25 years ago when she was first diagnosed. There was no practical cure, and there's no practical prevention, either today or then going back then. And so if we do get this diagnosis today, what can we do? Well, my dad told me sometimes terrible things are going to happen. And when bad things happen, we can yell and we can scream and we can revolt. Or we can step back, understand what is, and try and figure out how we can make the best of it. a cliche sort of is rather than worrying about the storm to pass, to try and learn how to dance in the rain. And so when we take a look at this disease and we get that diagnosis, one of the things we can do is give up and say there's nothing we can do, or there's something that we can do which is very realistic and very doable, and I think we can take satisfaction in. And that is to make a determination we are going to help our loved one live their best possible life. That we can do, that is doable, and something, again, that we can take comfort in. So how do we help our loved one live their best possible life? Well, we join their world. So I can remember once with Elaine asking me, how are my parents? So I said, they're both dead. No, they're not. She's Elaine. So when I finally convinced her that her parents both were dead, and I saw the look on her face when she realized she didn't say goodbye, much less attend the funeral, I promised I'd never put her through that again. And so the next time she asked me, how are my parents? Oh, I said, they're great. I said, your mom likes working at church. Your dad likes his sports. Elaine said, that makes me feel so happy. That makes me feel so good. And so that's what I call therapeutic fibbing. Therapeutic fibbing. So there are two things that I want you to know about therapeutic fibbing. Number one, I tried it the first year of marriage. Doesn't work so good. The second thing about therapeutic fibbing, and not everyone believes me on this, Chuck, but anyway, I want to be very forthright. Not everyone believes me. But if you remember the story about Moses and the Ten Commandments in Mount Sinai, well, anyway, I was there and I helped Moses. One of the things that you want to do is if you're helping Moses, don't call him Mo, because he hates that. So anyway, so we're on top of this mountain, and I said, Mo, how are we going to get these? Well, he said, we're going to work and pray. So Moses and I worked and we got this great big tablet of stone falling to the bottom of the mountain, and I looked at it. I couldn't read. I said, what is that? Well, Moses said, that's written in Arabic Hebrew. You can't read that. And I said, well, what is it? He said, that's the Ten Commandments. I said, well, what about bearing false witness against your neighbor? What about that? Yeah, it's in there. I said, gosh, I said, Moses, what about therapeutic fibbing and helping our loved one live their best life possible? He said, don't worry. So he said, Marty, he grabbed me called me by Marty, grabbed me by the, walked around to the back of these tablets of stone. And here on the back of the tablet of stone were written the words, therapeutic fibbing is good. Therapeutic fibbing is advisable. Don't pay any attention to the 10 commandments about therapeutic fibbing, because go thou forth into the world and therapeutically fib, because the goal is to help our loved one live their best life possible. And so if we can understand that, the matter of joining their world, as long as I tried to keep Elaine in my world. Elaine, it didn't happen on a Thursday, it happened on a Friday. It wasn't the Smiths, it was the Joneses. Why did you put the car keys in the... I'm telling you for the 5th time we're going... Her mind didn't know what she was saying. She couldn't remember. And one of the things that helps me talk with you a little bit about this is, so I'm going through this experience as a caregiver. I'm determining that if there's one thing worse than Alzheimer's, it's ignorance of the disease. Ignorance of the disease by the medical profession, as I pointed out. Also, ignorance of the disease by caregivers. I had no idea what I was in for. So I finally decided I've got to do something, and I decided to write this book to try and help caregivers. And lo and behold, maybe about 3 weeks before I'm ready to go to print, I find a series of notes and journals that Elaine had been keeping since her diagnosis. I want you to know that we had cried together and we had prayed together, but never did I understand two things. Number one, the courage that it takes to be diagnosed with this illness and then continue forward. And also never did I understand how much of a lifeline that I was for her. And so here I am, her lifeline. She knows that she is losing her memory. And in addition to knowing that she's losing her memory, she's worried and concerned about what the future might be. And I reprimand her for things that she does. I insist her parents are dead. I insist any number of other things. And so one of the great challenges of a caregiver is to get to the point where you can let go of this person who once was, so you can embrace the person who now is. Certainly easier said than done. But what is our goal? Our goal is to help our loved one live their best life possible. We do that by joining their world. And trying to keep them in our world is nothing but frustration, despair, anxiety, all the things that we just really don't need. So the title of the book is My Two Elaines. And the first Elaine, well, that was the wonderful girl, as Chuck pointed out, that I fell in love with when I was a freshman in high school. And 4 children and 13 grandchildren and now 11 great-grandchildren. But my friend, my advisor, my everything that you could ever want in a life's partner. And so that was the first Elaine. One of the greatest things she ever did for me. So I would run for political office. She'd be the hardest working campaigner. If I would lose, however, she would never let me feel defeated. And I think as caregivers, one of the things that we have to understand is we can never allow ourselves to feel defeated. As I said, we're going to have bad things happen. It's going to tear our heart apart. But we still have that opportunity to know we can do something, and that is help our loved one live their best life possible. So that was the first Elaine, making sure that if I would have something that would go wrong, I could never allow myself to feel defeated. And I've carried that with me and share that with you. The second Elaine, well, she began to appear when she was about 64, 65 years of age. And she would get lost driving to and from places she had been going to and from for the last 10 years. She was a great cook, sometimes would mess up her recipe so badly that she would cry. And that was the beginning of the second Elaine. And so in that journey then, as I said, there's a number of things that I learned. One of the things that comes into mind, so Elaine was roughly half-time with me and roughly half-time in assisted living memory care. And so we're having lunch once in the cafeteria at assisted living memory care. And she looks at me and she starts to cry. I said, Elaine, why are you crying? Well, she said, I'm beginning to love you more than my husband. I didn't ask her what's wrong with her turkey husband. I didn't do that. But here is what that meant to me. It meant that it is not necessary for her to know my name in order for our hearts to touch. Hearts can touch by giving a hug, by holding a hand, by singing a song, by just being with someone, by giving a smile. And so many times people say, well, first of all, it's so painful when our loved one no longer remembers our name, but that's not what is important. Our goal is to help our loved one live their best possible life. And we do that by understanding it's hearts touching. That's what's important, not what is my name and don't you remember when and so forth. And so many times people say, well, it doesn't do any good for me to go see so-and-so because they don't know who I am anyway. That's not true. I don't believe it. Maya Angelou said, the poetress said, I may never remember what you said. I will never remember what you did, but I will always remember how you made me feel. And we can have our loved one feel better by joining their world, by having hearts touch. That just makes such a big difference. And so one of the challenges of caregiving, in addition to what we are talking about, it is what I call not a chicken casserole disease. Hypothetically speaking, I have open heart surgery and people bring me chicken casserole. I have hip surgery and later people bring me chicken casserole. Well, now because my wife has Alzheimer's and because people are ignorant of the disease, they don't know what to say and they don't know what to do, so they stay away. And so now all of a sudden, after friendship of 5, 10, 15, 20, 30 years, decades of friendship, all of a sudden they're not there. Well, not because they're mean, not because they want to be harmful, but because they don't understand the disease. And I'm probably responsible to a great degree for not bringing them along on the journey. And that makes such a big difference. So when we take a look at this, our goal is to help our loved one live their best possible life. Remember, I said that when Elaine wrote her notes, and oh, by the way, every chapter of the book begins with some of Elaine's notes. We went through them in detail, my two daughters and I, and we picked out what we thought to be the most valuable notes that she had written. And so every chapter begins with some of her notes. And as those notes would be read, you would see how much of a lifeline that I am for her. And so let's assume hypothetically that I win the lottery and I've got a lot of money and I'm going to take all of you on a cruise in the Gulf of Mexico. And so we're on the cruise in the Gulf of Mexico and we're having a great time and everything is good. And one of you falls overboard and we throw you a lifeline and you grab it and you're saved. No, you're not saved. Well, why? Well, because the lifeline broke. Well, why did it break? Well, because it was weak. Well, how did it become weak? It became weak because someone gnawed at it, so much so that it became ineffective. Here is what we caregivers do. We are a lifeline to our loved one. And what we do is we gnaw at that lifeline so it can be weak and ineffective. How do we gnaw at it? We don't get enough sleep. We don't get enough respite. We don't eat well. We don't get enough exercise. And maybe, like in my case, you get into drinking. And so here we have a terrible disease. We want to make sure that we can do something that can overcome the impossibility of a cure, helping our loved one live their best life possible. And what are we doing? We're gnawing at the very lifeline that is going to help our loved one live their best life possible. It doesn't make any sense. One of the aspects, the title of the book, My Two Elaines, the healthy Elaine, and then the Elaine who was ill. There also should be two Martys. And if you are a caregiver and your name is Mary, there has to be two Marys. If you're a caregiver and your name is Sam, there has to be two Sams. And let me give you an example of what I'm talking about. So when Elaine was first diagnosed, the doctor says there's 4 things that we should do. Numenda and Aricept. Those are 2 drugs that are supposed to delay the symptoms. If they did, I don't know, but they said we did it, so we did it. Now, socialization, so very important for socialization. Number 3, walking. That's the best exercise for the brain. And fourthly, a glass of red wine every evening. Well, Elaine got 4 weeks ahead with a glass of red wine every evening and 3 weeks behind in the walking. But anyway, let's talk about the walking for a moment. The first, Marty, what is a walk? Well, a walk is a half an hour, 15 minutes that way, 15 minutes this way. That's a walk. Well, what about if you're walking with your loved one and she says, look at that beautiful flower. No, we've got to get this walk in. Or do you hear the singing of that? We have to get this walk in. And so the first Marty is interested in form and making sure his wife is always neat, making sure that she doesn't do anything embarrassing and so forth. The second Marty understands this disease. And the second Marty understands when you're going for a walk and you have an opportunity for a moment of joy, you grab it. You grab it and you hang on to it. And you hear the bird or you look at the flower. The first Marty, arrogant, self-centered, I can do it myself. The second Marty is smarter. The second Marty understands he can't do it by himself. The second Marty understands that to ask for help means you're not giving up. To ask for help is a sign of strength. To ask for help is a showing of love to your loved one. To ask for help means that you are continuing to love all of the other people in your sphere of family. Because if you don't take care of yourself, you're going to die before your loved one. And what good does that do anybody? The job of a caregiver is probably one of the toughest jobs in the world. Among all of the other experiences that you have, the worry and the anxiety, I had a friend, 75 years old, wonderful person. He went for a walk, came home, sat in front of the TV, and died of a heart attack, a snap of a finger, gone, tough. There was a funeral. People came by to express their condolences, and there was closure. There was closure. A caregiver never really gets closure. A caregiver sees their loved one disappear a little bit every day. And so when we caregivers are feeling all of this worry and all of this anxiety and all of these feelings, we have to understand, I believe we are also going through a process of grieving. Some people call it I don't know, different types of grieving, but I call it, there's anticipatory grief, and I call it unacknowledged grief. And so we have to understand all of the different layers of emotions that come through as being a caregiver. And certainly grieving is one of them, but also the worry and the frustration is one of them. And so we're a lifeline. And we have to make sure that we do everything we can to help our loved one live their best possible life. And certainly we can do that. So I think what I want to do is just read with you a few of Elaine's notes, just to give you a sense what is going through the mind of a person who is living with this disease. She writes, this was when she was diagnosed, she wrote a letter to her dear loved ones. And this is the part of the letter. She writes, it wasn't until a few weeks ago that I really had to say, yes, I do have Alzheimer's. I had read of signs that indicate Alzheimer's, like getting overly upset for no reason and having trouble with names and directions. But I still didn't think it was a problem for me. But in hindsight, for too long, I've been getting lost driving, having trouble keeping days straight, and difficulties with names and schedules. I still feel I could handle it. It won't get worse. But this morning, I started reading about the mid-stage of Alzheimer's in hopes of preparing myself better, and realized I'm not very far away. That is most scary, but I have to accept it. And so to give you a sense of the different emotions and feelings that she's going through, she writes on this one day, I wish my Alzheimer's would dissipate. I'd like to be the smart wife and mother I used to be. Now, I have to waste so much time just trying to figure out what I should be doing without seeming as smart as I used to be. I need to rely on Marty for everything, and I'm very lucky he continues to keep me. Life gets more difficult every day. I want to just repeat this one phrase, but for the next notes that she writes. She writes, I need to rely on Marty for everything, and I'm very lucky he continues to keep me. Now, another day in the life of a person living with Alzheimer's. I am not enjoying my role anymore as Marty's wife. Because of his having concerns about my Alzheimer's, he doesn't let me be me. He doesn't let me go for a walk if I want to, or to the store alone. I used to appreciate him, what I thought was concern, but he holds me captive much too much. I'm going to try to have a second opinion because I really don't think I have any problem. I know how to drive or walk any place I want to, but he doesn't believe me, and I hate the control he has placed on me. I don't even think I have Alzheimer's per se. And so my last one, and my very favorite one, and which I carry with me a lot, particularly the last line, well, I'll read it for you. So she writes, life is good. And I plan to have it continue that way until my children tell me it's time for a nursing home or something like that. This is realistic with what my Alzheimer's book says about my future. But till then, I will try my best to be normal, whatever that means, and keep my happy side of life always continuing. I'm lucky to have such a good family and many friends to help me get through all this. And so another great day to thank the Lord and smile, smile, smile. And so to my dear caregiver friends, we can help our loved one live their best possible life that's doable. We can make sure that we do everything we can to make sure that we're not going to feel defeated. And also we can look at it as another great day to thank the Lord and smile, smile, smile. So let me just conclude, Chuck, by sharing a little bit of discussion about prayer, patience, and persistence. And someone told me the story. I don't know if it's true or not, and some of you may have heard it, but prayer, patience, and persistence. So I'm told this lady had this parrot, And the only words that this parent knew was, Polly wants a party, Polly wants a party. Well, she's expecting out-of-town guests. And she's thinking, what are they going to think of me if I have this parrot and the only words the parrot knows is Polly wants a party, Polly wants a party. She becomes so distressed about what is going to happen to her image and her reputation. She goes to see her priest. She says, Father, she says, please help me. I don't know what to do. I have this parrot. Polly wants a party. Polly wants a party. My friends are coming over. They're going to think, what do I do? The priest said, this is a miracle. He said, I myself have two parrots, Peter Parrot and Paul Parrot. He said, I've had them for 7 years. And he said, all they do is pray. Peter Parrot and Paul, all they do is pray. Every hour of every day of every week of every month of every year for 7 years, they've been praying. And what we should do is take your parrot and put it in with my parrots. That will be a good influence on your parrot, and that'll take care of the problem. And so they agreed that was a great idea. So the lady went home and got her parrot, brought it over to the priest's home, opened up the cage, put the lady's parrot. Sure, Polly wants a party. Polly wants a party. Peter Parrot looked at Paul Parrot, said, our prayers have finally been answered. So, Chuck, thank you for the opportunity, and to your team for what you're doing here. And we hope that both Dr. Barrett and I know I can speak for him with just help all caregivers on their journey.
Well, thank you, Marty. That was. Now, I've got a couple questions, and we're open to questions in the chat or from YouTube. Many people, there are these memory units, memory care units, assisted living facilities, and many times putting the loved one, when they get to a certain stage that you really can't be with them 24 hours a day, putting them in a facility is a very helpful thing to do. And yet we have this inner compulsion that we promised we never would put them in a facility. So I'm curious, how do you handle that? What is your reaction to that?
Well, first of all, I think it's one of the toughest decisions that a caregiver has to make. And basically, we take the vow till death do us part. Well, we shouldn't encourage the death, okay? And so I sort of look at it as a balance scale. Whenever the health or safety of the caregiver or the person living with Alzheimer's becomes dangerous health or safety, then it's time to do something. So what happened in my instance is my children actually had an intervention with me, and they sat me down and they said, Dad, if you don't do something, you're going to be dead before Mom. Okay, so that was sort of a knock aside the head, a wake-up call. So I was going also to counseling, and I go see the counselor, and she said, now what's wrong? I said, I cannot see putting Elaine into a nursing home, into assisted living. And the counselor said, you're not putting Elaine anyplace. What you are doing is you are giving her a chance to be who she is now. Can Marty Schreiber's 24/7 nursing home care take care of her? No, I was becoming irrationally irritable. I was no good. My health was failing and so forth. And so that was another ringing of the bell, another knock on the side of the head. What I realized is it was my personal pride against Alzheimer's, not what is in the best interest of helping my wife Elaine live her best life possible. So again, it's a very difficult decision. And not only is it difficult emotionally, psychologically, and so forth, it's very expensive. And people have to try and analyze how best they can get, journey through this with being able to help their loved one. But it's one of the additional challenges of being a caregiver, and why it's so important for a caregiver to, if at all possible, have some good mentoring, some good counseling, support groups and so on. You can't do it alone. And I think if there's one message that I would want to just drive home, you're a lifeline. You can't do it alone. You got to keep yourself aware and alive and well, not only for your loved one, but also for the other people in your family circle.
So, so many times the person with Alzheimer's thrives in the memory care unit. What they find is the staff is working with them. They have other people they can relate to, and it actually becomes a very positive experience. Okay, but I've got another thing. As males, male caregivers probably have more difficulty than female caregivers. I think men aren't as familiar with running the house. They're more reluctant to ask for help and advice. Have you any advice to men that find themselves in the caregiving position?
Well, I guess one of the things, Chuck, that I go back to, there had to be two Martys, okay? There was the first Marty who was too arrogant and self-centered and knew he could do it all by himself. You have to have, there has to be two of you, and you have to then make that adjustment. Again, joining the world of the person who now is admittedly very difficult. And so, counseling, support groups, just anything. And maybe Dr. Barrett has some observations on this too, to be able to help give some guidance to men. But and also, what is a challenge here? We're talking about older people as caregivers, but I've met with young men that 30, 40 years old who taking care of their mom. Well, how many times does a son give their mom a shower? And how many times does a shower, and so it's a tough goal. And just to understand, if we can clear everything away and just say, what is our goal? Helping our loved one live their best life possible. That sort of, to me, is sort of a helpful path that gives us a goal. I don't know, Dr. Barrett, what do you got any thoughts on that?
Nothing specific to what you've added. Your comments come from experience, so I accept those as being greater than what I could offer. But nothing to add to that.
Okay, thank you.
Dr. Barrett, I have a question for you. In running a memory clinic, frequently the family and the patient come in. The patient goes with the neuropsychologist, and you talk to the family, and they describe the person at 11 o'clock in the morning. They go in and they finally get them out of bed and get them dressed and take them down for breakfast. The patient then comes in and you say, how are things at home? And the patient says, they're fine. I get up in the morning at 8 o'clock, I dress myself, I eat, everything's normal. And this seems to be a big problem because it leads to the catastrophic reactions to this. I'm just curious as to your reaction to that.
It's a challenge. It's so different than any other symptoms or neurological issues that I might evaluate someone for. So I also see plenty of patients with Parkinson's, and the patient is the primary person here. But when it comes to dementia, the primary informants really are the family. And I don't always have the benefit of having an easy person to have them go see, like neuropsychology. So sometimes we get creative with, nursing, checking their vital signs, but anything we can do sometimes to get the story from the family, allow the family to talk, free of, concerns about speaking in front of their loved one, because that might just cause conflict, which it can do. So it is it's all in the hopes of helping the individual that's suffering. But to do that properly, we sometimes really do need to separate people to get the story of about what's happening.
Let's open it up to anyone. Does anyone on the Zoom call have questions?
Doesn't appear, Chuck, to be anything in the chat.
Well, being a caregiver is a very difficult proposition. My father cared for my mother with Alzheimer's for 15 years in an assisted living facility where the two of them struggled greatly back and forth, but he refused to get help. And I wish we'd had this discussion available to him so he could have seen that there was a different way to do it. I think there's a lot to caregiving. I don't think physicians are particularly the best people to talk about caregiving. It's more nurses and social workers, the Alzheimer's Association, the Agency for Aging. There's a lot of people that know more. But I think having Marty Schreiber talk to us about his experience, I think that's been very, very helpful.
Thank you.
All right. If there's no other questions that have surfaced, I would like to thank Marty for your personal experiences. Without your explanations and details, we would not have understood so much about your wife and what she went through. And Dr. Barrett, your wonderful background and medical information helps us realize what they are suffering and what's going on. So the combination of both of you is a blessing. And NACRA thanks you both for your time, your expertise, and maybe we can do this again on another subject. So thank you all very much for coming. This has been wonderful, and have a great rest of your day. Bye-bye.